Mania. Classic symptoms include rapid speech, racing thoughts, decreased need for sleep, and hypersexuality. Because manics have high energy, sleep deprivation and psychosis could appear, further complicating the ability to think clearly. Racing thoughts and misperceptions lead to frustration and decreased ability to communicate with others. Manic individuals may. They could engage in questionable business transactions, wasteful expenditures of money, risky sexual activity, or high vocal arguments. These behaviors increase stress in personal relationships, problems at work, and increases the risk of run-ins with the police. They are at high risk for impulsively taking part in activities potentially harmful to self and to others. Manic episode. They will do an excess involvement in pleasurable activities. They will have a high potential for painful consequences, engaging in unrestrained buying sprees, sexual indiscretion, foolish business investments. It's very important for a manic patient to carry finger foods and liquids, as they do have a tendency to lose weight. Hypomania. Now this is still a manic state, just a lower mild manic state. It is distinguished from mania by the absence of psychotic symptoms and by its lower degree of impact on functioning. It is in this state that many creative talents are in their most productive and successful moods. Ideas come to one with hypomanics easily, and they are full awareness of what they are doing. Bipolar disorder is a psychiatric condition defined by recurrent episodes of significant disturbance in mood. These symptoms range from debilitating depression to excessive mania. Bipolar disorders. Diagnosis of bipolar 1 requires at least one manic or mixed episode. Bipolar 2 is rapid cycling and is defined as having 4 or more episodes per year. It has been associated with greater disability or a worse prognosis due to the confusing changeability and difficulty in establishing a stable state. Rapid cycling can be induced or made worse by antidepressants unless there is adjuvant treatment with a mood stabilizer. Cyclothymic disorder now is a milder form of bipolar 2 disorder, and this revolves between hypomania and dysmic mood. Remember, dysmic is not enjoying previously pleasurable activities. A single episode of hypomania is sufficient to diagnose cyclothymic disorder. However, most individuals also have dysmic periods. Epidemiology. Medical conditions such as brain tumor or an overactive thyroid gland can cause manic symptoms. There are certain medications such as steroids and antidepressants that can cause mania. Most rapid cyclers are women. Etiology. Because drugs and bipolar illness both alter mood, cognition, and behavior, there is considerable symptom overlap between drug abusers and persons with manic depressive illness. It is not surprising that substance abuse can mask bipolar symptoms. Substance abuse can also precipitate an episode of manic or depressive psychosis. Keep in mind that psychosis induced by LSD, PCP, or amphetamines can be attributed to schizophrenia rather than bipolar disorder. Drug effects can mimic nearly any psychiatric disorder, particularly with chronic drug use. Clinical course. Virtually all clinical trials of medication for the non-depressive phases of bipolar illnesses involve treating patients for psychotic mania during the initial or acute phases of mania. Typical prescribed medications for hypomania include mood stabilizers and atypical antipsychotics like Depakote. Clinical course. Support for the disease due to biochemical abnormality of the brain is supported by PET scan, positron emission tomography. This involves the subject inhaling or being injected with radioactive tracers, which are absorbed into the brain tissue. Increases or decreases in cerebral blood flows to and from regions of the brain are measured by radiation counts. Clinical course. Mania is typically shorter than depression. Now, a few people who appear to experience only mania, which is also known as unipolar disorder, may actually have mild or brief episodes of depression. Mania and hypomania are less common than depression, and they are also less easily recognized. Extreme sadness might prompt a visit to the doctor, but hardly charged emotions usually are not. This is because people with mania are unaware that anything is wrong with their mental state or behavior. Social prognosis. They need a support system, and that includes a healthcare provider, trusted family members, friends, clergy, therapists, support group. A support system can help the patient avoid problems when symptoms return and find ways to cope with the problems. They can help the patient to keep their healthcare provider appointments and make sure they take their medications. Associated disorders, dual diagnosis. Now, an associative disorder are lifelong conditions that can affect every part of their lives, and it must be a part of their treatment. The dual diagnosis is that they will have this with substance abuse, schizoaffective disorder, borderline personality, bipolar disorder, strongly linked to postpartum depression. Bipolar disorder and creativity. Mania and mood disorders again are linked with artistic and creative people, and many will also have lesser forms of mania with mood swings. Pharmacological treatment. Acute mania may be treated with benzodiazepines, neuroleptic agents, Haldol, valproic acid. Monitoring for polypharmacy means this is a patient who might take 10 different types of pills. It's not 10 of the same pill, but 10 different pills. So polypharmacy is a common cause of mania in elderly with no history of mood disorder. Maintenance treatment with lithium. Now, they must evaluate the thyroid, the kidneys, and the nervous system. One of the medications, especially with this to monitor, is going to be that methyl-dopa or Aldamant might increase the likelihood of lithium toxicity. Lithium can also cause a goiter or hypothyroidism. The use of a beta blocker like propranolol, which is also known as Enderol, with lithium can lead to a slow heart rate and dizziness. Other beta blockers, for example, metoprolol, also known as Lopressor, or atenolol, also known as Tenormin, may also interact with lithium and be associated with a slow heart rate. Maintenance treatment with lithium. Now, these medications may take several weeks to be effective, but they do work well and are generally safe. There are three main groups of antidepressants: the SSRIs, the tricyclics, and the monoamine oxidase inhibitors. The SSRIs, such as Lexapro, help to relieve the symptoms of depression by increasing the available supply of serotonin, a substance in the brain believed to influence mood. Maintenance treatment, anticonvulsants. Tegretol, valproic acid, and other atypical antipsychotics all may have some safety advantages over the lithium. Maintenance treatment, anticonvulsants. Valproic acid is an anticonvulsant medication originally used in the treatment of epilepsy, but it is highly effective mood disorder. It is often the first choice for rapid cycling bipolar disorder, mixed mania, or mania with hallucinations or delusions. People may take from 5 to 10 days to respond to valproic acid. Maintenance treatment, atypical antipsychotics. Olanzapine has been approved by the FDA for the treatment of schizophrenia, manic episodes, agitation associated with schizophrenia, and bipolar disorder, as well as a maintenance treatment in bipolar disorder. Maintenance treatment, antidepressants. Now, antidepressants are usually taken as a course over several weeks, months, or years and have a delayed onset of therapeutic action. Despite the name, antidepressants are often used in the treatment of other conditions, including anxiety disorders, bipolar disorders, eating disorders, and chronic pain. Some have also become known as lifestyle drugs, or referred to as mood brighteners. Psychotherapy. Psychotherapists employ a range of techniques based on relationship building, dialogue, communication, and behavior changes. All of these are designed to improve the mental health of a client or a patient, or to improve group relationships, like in a family. Other treatments. With electroconvulsive therapy, electrodes are placed on the head and an electrical current is applied to induce a seizure in the brain. For reasons that are not understood, the seizure relieves depression. Usually 5 to 7 treatments, one treatment every other day, are given. Because the electrical current can cause muscle contractions and pain, the person undergoes general anesthesia during treatments. Electroconvulsive therapy may cause some temporary, although rarely permanent, memory loss. Calcium channel blockers are a class of medications that are approved to treat high blood pressure, heart failure, cardiac arrhythmias, and similar conditions. There are multiple types of calcium channel blockers, but verapamil and nimodipine have received the most attention with regard to treating bipolar disorders. Through calcium channel blockers, mood regulation effects are smaller in magnitude than those produced in lithium or the anticonvulsant mood stabilizer. They are nevertheless very useful for some patients and are deserving of mention. Nursing theory. Rosemary Parcy's theory deals with how nurses try to understand the patient's way of life. It is important to establish what she calls the trust relationship. And here's Orm, states that nurses help patients who cannot help themselves. One-on-one time is very important in the self-help theory. And then families. Families really want to first know about the disease and then what to expect. And this is true not just in mental illness. There's a strong link between bipolar disorder and postpartum psychosis. Even if a woman has had a hysterectomy and bipolar disorder, if she shows depression symptoms, she could be suicidal. Experienced nurses give advice. You don't want manics to do team sports. Someone is going to get hurt. Private seclusion with the door slightly open could be an intervention. And remember that they have to carry those finger foods and those liquids.